Hi, this is Dr. Lisa Lilienfield from Kaplan Center for Integrative Medicine. Today I'd like to discuss the functional medicine approach to irritable bowel syndrome, or IBS. So, functional medicine physicians really are detectives, and they want to determine the root cause of the symptom as opposed to just labeling the symptom and writing a prescription for the symptom of the condition. So IBS can be multifactorial. We often look at what's called ATMs, antecedents, triggers, and mediators. And antecedents to IBS could possibly be even start from birth. For example, if a baby is born by C-section, they may not get as much of the microbiome from their mother through a vaginal birth. If they're bottle fed, they may not get the microbiome from the mother and the mother's milk. If they have recurrent infections as a child and they're on a lot of antibiotics, this can alter the microbiome in the gut and later set up some of the conditions of IBS. So those are antecedents. Triggers can be from an intolerance to a specific type of food. It could also be an infection, such as a parasitic infection or some kind of gastroenteritis that sets up the condition of IBS. Mediators are things that keep the symptomatology going or that keep the condition persistent. And this can be a leaky gut situation, an inflammation of the gut, a maldigestion or malabsorption of nutrients. So in our history, we want to explore these ATMs. In addition, we have specific testing that we can do, such as stool testing that looks at the total microbiome. Do you have enough good bacteria? Do you have an overgrowth of bad bacteria? Do you have yeast overgrowth? Are you breaking down your proteins and fats appropriately? Do you have enough pancreatic enzymes? Are there inflammation markers in the gut that can indicate inflammatory bowel disease, for example? We also can do some testing to look at yeast overgrowth, either blood tests or urine tests to look at yeast metabolites. And if we suspect something called SIBO, small intestinal bacterial overgrowth, we can do a breath test to determine if there's hydrogen or methane after a carbohydrate load. In addition, we will rule out celiac disease with blood work to determine if that is the cause of irritable bowel syndrome. So once we've determined what is going on in the digestive tract, then we can treat. There are some medications we use, there's herbals, there's definitely dietary treatments. We work with our dietitian very closely. Pretty much 100% of our IBS patients must see our dietitian, who's really fantastic and such a great specialist in this field. So we are much more detectives. We want to find out the root cause and be much more thorough in our understanding of IBS as opposed to just writing a prescription. Now, in some cases, we do need the input of a gastroenterologist. We might need an endoscopy. We might need a colonoscopy. We might need a HIDA scan to look at the gallbladder function. So we do work with our conventional docs, but this is something that we are very adept at treating, this irritable bowel syndrome. Thank you.